Hello, everyone. Good afternoon and welcome to the Major Depressive Disorder, an Overview of Treatment Considerations webinar sponsored by Otsuka America Pharmaceuticals, Inc. and Lundbeck. My name is Teresa Nguyen from Mental Health America, and I would like to thank you for joining us today. So before we get started, I'd like to start with a few housekeeping items. Today's webinar is being recorded and will be available at Mental Health America's website at www.mentalhealthamerica.net. Audio is being streamed through your computer speakers, so there's no need to dial in by phone. I want to give everybody a brief overview of the webinar. The information shared today is meant for educational purposes only. It does not imply an endorsement nor recommendation for any type of treatment nor a specific medication. People should always seek advice on treatment from an independent, qualified healthcare professional. So, what we'll be doing today is we will be defining what major depressive disorder is, and discussing available treatment options, treatment challenges, and unmet needs. Many of those joining today's webinar are very familiar with major depressive disorder and how the disease impacts you or someone you know, whether that's a friend, family member, colleague, or your support group. So in this presentation, we're discussing major depressive disorder, or MDD. Many people commonly refer to it as depression, and that's what we'll refer to it throughout today's webinar. Depression is a common but serious mood disorder. It causes severe symptoms that affect how people feel, think, handle daily activities such as sleeping, eating, or working. And really, to be diagnosed with depression, the symptoms must be present for at least 2 weeks. Okay, so depression, what does it look like? What does depression look like over the course of a person's lifetime? So signs and symptoms of depression often include persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism. Often people feel irritability. There's a loss of interest or pleasure in hobbies and activities, certainly a decrease in energy or fatigue, difficulty concentrating, remembering, or making decisions, changes in sleep patterns, appetite or weight changes, and thoughts of death or suicide, or possibly having a suicide attempt. Depression can impact people differently, so not all people with depression experience the same symptoms or nor to the same degree. The symptoms of depression can result in personal or professional challenges for adults who live with it. So depression can alter functioning in several areas of life. This can include work and school, how someone can maintain their health or their hygiene, and certainly social relationships and leisure activities. From an individual perspective, the symptoms of depression can impact many aspects of a person's life. In addition, depression has a substantial impact on society. So an estimated 16 million Americans live with depression. So to put that into perspective, that's more than the population of New York City, Los Angeles, and Philadelphia combined. Depression is the second leading cause of disability worldwide, and it's estimated that depression-related workforce productivity losses in the U.S. are $24 billion annually, which is a significant number. For people who aren't familiar with depression, these numbers could be surprising. But as we learn more about the impact of mental health issues, we're understanding just how devastating a disease like depression can be. Sorry for the delay on the slides here. Oops, that was the impact of depression. Okay. So The American Psychiatric Association makes the following recommendations for the evaluation and care of someone who is diagnosed with depression. People should be included in decision-making, and their preferences and concerns about treatment really should be taken into consideration. People should be upfront and honest with their healthcare provider, who should establish complete assessment and accurate medical history that includes your general medical condition, your family history, past treatment experiences, any history of substance abuse, and all healthcare providers involved in the patient's care should have some kind of ongoing contact with each other to help coordinate care and share important information. An emerging area in depression care is the use of rating scales or other measurement tools to track changes in symptoms over time and the potential effects of treatment. So a healthcare provider may ask people a series of questions to help gather information needed to appropriately measure your progress. So a patient's healthcare provider should provide education to you when it's appropriate, to your family, use language that's easy to understand, answer questions about your disease and about your treatment, and emphasize sticking to a prescribed treatment plan. So a doctor should also speak with people about healthy behaviors like exercise and sleep patterns, good nutrition, minimizing tobacco, alcohol, and harmful substances. Today, we know that depression is thought to be underdiagnosed. People may not seek help because they're worried about what others might think of them. Depression might also be misdiagnosed or mistaken for other conditions, such as chronic fatigue, pain, or specific, non-specific somatic complaints. So because of this, treatment for depression is often delayed. For example, in a sample of over 9,000 people, the median time between the first experience of a depression symptom and the first contact with a healthcare provider is projected to be up to 8 years. It's clear from the impact depression symptoms have on individuals and society that really effective treatment then is so important. So various treatment options that are available to someone suffering from depression include psychotherapy, medications, brain stimulation, self-help, and support groups, and alternative medicines such as acupuncture. So treatment does have varying degrees of success for different people. For some people who live with depression, symptoms might be alleviated with the first treatment they might be prescribed. However, for others, they might need several approaches before finding what might work for them. And though there are many options for treatment of depression that adults who live with the disease can explore, antidepressant medications is currently the most commonly used medication option or treatment option. In many cases, people who are taking an antidepressant as prescribed will still experience symptoms of depression. People may also struggle with side effects, which can affect the progress they are able to make on their treatment. But let's talk more about antidepressants and how a healthcare provider selects a treatment for his or her patients. So antidepressant medications are generally equally effective in most people. Treatments are often selected based on side effects and other factors. These factors include the chemical makeup of the treatment and how it works, severity of symptoms, prior treatment experiences, presence of co-occurring disorders or diseases, costs, patient's preferences, and certainly before prescribing any medication for depression, healthcare providers should evaluate the unique combination of symptoms that a patient is experiencing, as well as any other factors that might impact their treatment. There are 4 distinct phases of treatment for depression. That includes an acute phase, a continuation phase, a maintenance phase, and a discontinuation phase. So a physician and or a patient who's monitoring and reporting during each of these phases can help determine the trajectory of a patient's depression and the effects of a treatment. So I'm going to go through and discuss each of these phases. In the acute phase, the goal of treatment is to control a depressive episode. In a continuation phase, the goal of treatment is preventing the return of another depressive episode. During the continuation phase, it's important for healthcare providers to continually assess symptoms and monitor for side effects, as well as help people take their medications as prescribed. Continued treatment may be needed in a subset of people who are not stable or to prevent reoccurrence of depressive symptoms. People who have had 3 or more episodes of major depression are candidates for maintenance treatment. So maintenance therapy should also be considered for people with other risk factors for reoccurrence. And these risk factors include ongoing symptoms, presence of a chronic medical disorder, earlier age of first episode, ongoing life or social stressors, for example, maybe a challenging relationship or a loss of a job, persistent sleep disturbances, family history of mood disorder, severity of depressive episodes is also another risk factor for reoccurrence. So the next phase is the discontinuation phase, and the discontinuation phase is something to be considered for stable patients, right? The decision to stop treatment should be based on several factors. These factors include the likelihood of another depressive episode, the frequency and severity of past episodes, a patient's or person's preference, and before ending treatment, people should be informed about the potential for relapse, and a plan should be established for seeking treatment if symptoms do reoccur. So people should never stop any treatment for depression without first consulting with their doctor. And you can see from the phases of treatment that we've covered that treatment for depression can be complex and challenging. What works for a patient may not always be immediately clear and may change over the course of their disease. So for about half of people with a single episode of depression, people will recover and have no further episodes. But for approximately 1/3 of people, they will continue to experience ongoing symptoms, and these ongoing symptoms can increase the risk of relapse. For some people may not respond also to just any one type of treatment. So what do we do when treatments aren't working as expected? Clinicians may consider a change in the initial treatment plan if there was not, adequate improvement in certain phases and evaluation periods. The time frame for this can vary, but guidelines suggest that a change in treatment should occur if a response is not observed within 4 to 8 weeks. Current guidelines recommend additional strategies for people who do not respond to or only partially respond to an antidepressant. So this can include increasing the dose of a current antidepressant, especially if a person tolerated that medication well. Another option is to switch to a different antidepressant. Another option is to change or augment, that means add, psychotherapy in addition to medication. And the last one is to combine the antidepressant with an additional medication. So these are 4 options. We're going to talk about each of these options. So for people who are treated with an antidepressant, optimizing the medication dose is a reasonable first step. This is especially the case if the side effect from the medication is tolerable for the person. The upper limit of the medication dose has not been reached. So that means that if somebody hasn't reached the most that they can take for prescribed medication, then the doctor might consider increasing that dosage. And that's an option somebody can evaluate in terms of modifying the current antidepressant they're on. The second option when treatments aren't working as expected is to switch to a different antidepressant. People may be changed to an antidepressant maybe from the same pharmacological class or to one from a different class. Adding or changing to depression-focused psychotherapy may be considered also at this point. And what does it mean to change or to augment with psychotherapy? So people who are treated with psychotherapy, a healthcare provider should consider increasing the intensity of treatment or changing the type of psychotherapy, right? So somebody might be taking medication, but they might also be doing talk therapy. At this point, the doctor might ask if you would be interested in CBT or some other type of psychotherapy to go along with your treatment. People who have a history of incomplete response to any kind of single treatment might benefit from combined treatment with medication and depression-focused psychotherapy. So that means some kind of talk therapy that's shown to be effective for depression, such as cognitive behavioral therapy. So the next option when treatments aren't working as expected is to combine the antidepressant with an additional medication. So a healthcare provider might prescribe an additional medication to use in combination with a person's current antidepressant. And this is something that you would really want to talk to your psychiatrist about and your doctor about. They would help to take into consideration everything that's going on in your life to help you to make that decision. And really, all in all, when treatments aren't working as expected, I think it's really important at this time to make sure that if you do have changes in treatment, that people should be monitored closely. If changes to initial therapies do not result in an adequate response, another thorough review should occur. And sometimes this means that a person should go back and talk to their doctor and just stay in contact with that person who is helping you and let them know what's going on with your experience so that if things aren't working, they should be able to walk you through what those challenges might be, what your options are going forward in the future. And then certainly as you're going through a switch, a doctor will help you through that process and then will also monitor how things might be changing in the future. So during this time, the review that a doctor would go with you should include verifying and making sure that your diagnosis is correct, checking out maybe other mood problems that might be occurring, layers or kind of nuances to your physical health and your mental health. They might uncover issues that might be preventing improvement. So this can be another physical health condition, or if you have an alcohol or substance use problem that might be co-occurring with the mental health problem that's getting in the way. Another factor to really take into consideration is examining social or support factors. It's really important, especially for people who are struggling during these times, to get, all the support that they can get. So a person who might start treatment but still feels very isolated or doesn't have adequate support for school or for work, recovery can be very difficult. So what a treatment provider might do is to talk through those options or explore additional treatment options that might be available to you to enhance, those social or support factors like supported employment or supportive education. When we think about depression, what can you do as individuals, or what can individuals do? So it's important when you're thinking about your treatment that these decisions should be made with your healthcare provider. Although people who are making these decisions, the person and the patient is really the most important person. Because treatment for depression is not a one-size-fits-all, and different treatments have varying degrees of success for different people, it's important to work with your healthcare provider about what really is going on for you and for your symptoms so that you can make sure to find the right plan for managing those symptoms. One thing we wanted to make people aware of are some resources that we have available on MHA's website. Our depression screening tool is found on our website. So if you know somebody who is struggling with depression, but maybe they're not sure and they think that they might take a depression screen, the depression screen is available, and it's confidential and it's anonymous. You can take the screen. It will provide you with resources and additional information. You can print out your results and bring them to your provider. You can explore treatment options or questions or how you might navigate through your insurance problems that you might have, or how to start a conversation with a therapist, right, when you're struggling with depression. Another campaign that we have is really focused on how to encourage people to share what it feels like for them to have a mental illness. So if you go to MHA's website and you look at mental illness feels like, which is on the scroll, you're going to see people's personal stories about what it feels like to have depression. And this is because even though we shared with you earlier what those 9 symptoms of depression are, for many people, describing depression doesn't quite feel like that. So we tried to create a campaign to help people see what others were discussing and sharing about when it came to what their depression feels like and what recovery for them also feels like. In addition to working with your healthcare provider with some of the things that we've talked about today, there are also many resources for people who are suffering from depression. So on our website, we also have other information that you can read. You can also reach out to us if you have specific questions that you might have about your own personal needs. If you are in crisis, please call the National Suicide Prevention Lifeline. That's 1-800-273-TALK. Or you can text the crisis text line, text MHA to the number 741-741, or go to the nearest, contact your doctor or the nearest emergency department. Also consider visiting some of the other resources listed here and on our website, how to start and open up a conversation with your family, or maybe to access healthcare resources if that's something that you need. And as I said earlier, a recording of our webinar will be posted to MHA's website. If you have any additional questions, we encourage you to reach out. You can reach out to myself at tnguyen@mentalhealthamerica.net. And we thank you all for participating in today's webinar, and we hope that you receive just a little tidbit of something that might be useful for you and your recovery journey. Thank you, everyone.